Welcome, everyone. This is the week of mental health awareness. Week set aside. There's lots of information online about this issue, but I wanted to put it into context as to how I think and how I've seen personally, as well as among my colleagues and certainly among my patient population, how over the past year and a half, nearly 2 years, during a pandemic, how our lives have been affected. And I feel like many times in clinic, I'm speaking to the choir because I don't think, as a speaker I was listening to earlier this morning, I don't think any of us will get out of this pandemic without being affected in some way. Some seem to be less affected than others, but it seems to me that most have been affected either personally or in their own family network of friends and family. So I think it's a timely subject to have as a touchstone while we're talking about Mental Health Awareness Week, this first week of October. When the pandemic began, and soon months into it, my own colleagues all across the country, one in particular, a psychiatrist in San Diego, when I asked how things were going with his patient population, who had been mostly working with both civilian and VA patients, his comment was they had been doing pretty well up until the pandemic shutdown. I think prior to that, certainly, no doubt, in both military and civilian worlds, we are dealing with a strongly, highly likely to have a patient come in with some sort of emotional or psychospiritual problem that's contributing to their health. And, I don't think this is anything new to anybody. With many new patients that I meet who may be referred in for other causes, or maybe the issue is in and of itself related to issues like anxiety or depression. Recently working with someone who was referred over by a mental health practitioner who is already working from the psychiatric standpoint with this patient's problems, but so much of it comes from old trauma that it just seemed to have catapulted into more extremes during this past year and a half during the pandemic, creating triggers for this person's symptomatology of panic attacks, panic disorders. In the areas when I get to teach with residencies, medical schools, new residents, even physicians already in practice, in both civilian practices as well as military practices when we interface with the ACUS Foundation, with the U.S. Air Force. It's not surprising to hear these stories and how often the patient will present with more physical symptoms, but then as you dig a little deeper and dig a little deeper, there's usually as the saying we often say in clinic, there's usually a problem behind that problem, and if you can find that source, you're more likely to help the patient long term in a more comprehensive way. I think it would not be surprising to hear that many have come in with more standard issues that relate to depression, that relate to high anxiety, that relate to agitation. I have heard and seen physically patients just trembling, in tears, for lack of a better word, anger and rage. They're raging against the machine, but they're really all suffering from, I think, a community that's been under assault by something that we have no control over, or don't feel like we have any control over. And that's usually how humans get triggered. We don't, many psychologists I've talked to about this, we don't do well with uncertainty. Many books are written about this, many philosophies and religions talk to this. We're designed to have something in our grasp and our control, and when when it's not. That's very frustrating, but that can lead to behaviors of which I've just mentioned and accelerate them. I think somebody had mentioned a couple of terms over the years as far as pandemic fatigue. We're just so bloody tired of having this be upon us and how it affects our own personal schedules, our jobs, our family, our plans, just taking a vacation and maybe going over to somebody's house for a barbecue. It's gotten so much more complicated. It's gotten so much more having to think through everything as opposed to the good old days when we could just do whatever we felt like doing, even though, of course, there were some restrictions back then. So where do we go with all this information? I think the common ground that many therapists talk to is to understand and realize that, number one, you're not in it alone. I'm not in it alone. I'm blessed to have friends, family, loved ones that I can reach out to. I have teaching faculty I can reach out to, and I do. I have patients that are willing and able to sometimes share what's going on with them, and I think vulnerability is often a hard thing for all of us to have to be open and admit the fact that I need help. And if you don't have friends or family or colleagues, I'm encouraging those listening to this to reach out to mental health practitioners, some of them available 24/7 on hotlines. There are more extreme examples of suicide prevention hotlines. There are other local and national resources for Mental Health Awareness Week, which I'll include some of the links. I'll also include under this blog some discussion, a recent discussion in May of this year that an author had put up. He had a TED Talk popular some years ago, but his more recent, it was entitled How to Discover Your Why in Difficult Times, particularly with pandemic, which is why do we do what we do? Why do some in therapy, counseling, psychology, why do they do what they do? Why do I do what I do as a family physician? Well, I think a lot of us have had tough scrapes in life, have dealt with health issues, have dealt with life-threatening issues, and I think that has been a catapulting effect to guide us or to at least direct us into being a little bit more, hopefully being a lot more open to having these discussions. I can speak for myself in saying that there are many things that have happened in my own years, in my own life, that I think if they had not happened, I don't think I would have at least the awareness when I'm listening to patients who are willing to go down that path and let's talk about some of these deeper seated issues. The professional therapists and cognitive behavioral therapists and psychiatrists are very well equipped and help to get the help that those patients need. So with that, I'll end this short discussion. Hopefully it hasn't been dragged out too long, but if you or your own close-knit family members or those that you know in your circle of friends or colleagues, if you know anyone, if they're suffering and you're reaching out to them but you think they need help, encourage them to get the help and reach out and just be there to listen. And sometimes, I tell you, the only thing some patients will tell me, the only thing they really needed was just somebody else to listen to, that human connection, just to know that they weren't alone. And I think most agree this pandemic hasn't left many untouched in some way. So I want to wish you all the best, and certainly both from a physical as well as psychological and spiritual side.